Oh, happy day. We are talking about mental health as always, but it's Mental Health Awareness Month, one of my favorite months, the month of May. April showers bring May flowers. So we're talking about all the wonderful flowers that May brings along with us. We are all this month going to be talking about mental health from a variety of ways. And we have a couple of segue sessions because these were topics that kind of meandered over from April, which was Autism Awareness Month, into May. And so one of our topics for today was, what do I do when I have clinicians on the one hand telling me one thing, and then parents on the other hand? How do you deal with that dual reality? So this started out as a conversation about autism, but we're going to move it into general mental health. And then I'm going to pause for a moment, and then we're going to pick up on one of the topics that we were going to start with today, just so we don't fall behind, and that's on anxiety disorder. So let's talk about when parent thinks one way, but a clinician thinks separately. And I've already given you my testimony about the fact that my son's developmental pediatrician in December of, gosh, whatever year it was, 2011, said, "Yeah, I'm pretty sure your son is on the autism spectrum." And it took me, and I was like, "Nope, don't think so." It took me a whole 6 months into 2012, I believe, before I was ready to start the process of learning as much as I could about autism and parenting with autism. So it's a real thing. So I'm a professional, I'm a psychiatrist, but having my own child with autism, that kind of gave me some pause because I was thinking about all these other diagnoses and all these other things and hoping that there were some other things that were going on because I knew that there was a limit to what we might be able to do from the autism spectrum, at least at that time, 16 years ago. We make great advances every year, but 16 years ago, there wasn't as much known as there is now. There was more known than there was back in the 1980s or 90s, but still, there was a lot of concern about what next? What's the future hold? Now, I want you to think about that for whatever concern that you have, whether it's diabetes or chronic eczema, dermatitis, esophageal difficulties, or fibromyalgia, whatever it is. If you are a child or if you're a parent of a child, you may look at things from one perspective and it might be quite different than the clinician. Okay, so we're going to talk about a couple reasons why that might be and how to get on the same page, whether you agree or disagree. So, one of the main reasons that there might be disconnect is because the clinician is looking at things from the playbook. If they're psychiatrists, they're looking at the DSM. If they're another provider, they're looking at their provider manual for the different symptoms, the different diagnoses, the different syndromes that might be going on. Whereas you, the parent, you're basically saying, these are the symptoms I see. And guess what? You haven't read the book more than likely, or even if you're a parent like me who's a provider, you might not have read that section or might not see what an outsider sees because you as a parent, you see what you see. That doesn't necessarily mean that a complete and total stranger is going to see everything that you see. So you have to think about the fact that you're coming from two different perspectives, right? And you're trying to come to a meeting of the minds. Not a bad thing, very good thing. It just means that this clinician is coming from their wealth of knowledge, plus what they're seeing in the textbook, plus what they might have seen in their clinic that morning or that week or learned in a CMS conference or CME conference. Whereas you're going from your perspective as a parent, plus maybe some of your anxiety as a parent, plus only the symptoms that you're seeing. Now, the hope is that when you get together, that clinician's knowledge plus what you know about your child and what you're seeing comes to a meeting of the minds, and you can figure out, oh, that's what this is. This is XYZ. This is, oh, this looks like the common cold. This looks like there's a fever and Rye syndrome's going on right now, or there's a new strain of the flu going on. I think this might be the flu, okay? Or this is measles, or this is chickenpox, or whatever. But hopefully that's the main reason for there being disconnect. A second reason, unfortunately, may be that the doctor kind of already has seen so many things that when your child comes in with some things that kind of look like this, they're thinking if it looks like a duck, quacks like a duck, it's a duck. But you might say, well, yeah, it looks like a duck and maybe it quacks like a duck, but pretty sure this is a goose, right? And unless you've heard a duck versus a goose, you just heard something quack. Do you really know what it is? So there may be some preconceived notions, some ideas already floating around in this person's head, even before they come in the exam room when they're looking at the symptoms on paper. Nurse says, "Hey, the patient has XYZ," or MA says the patient has XYZ. They may already be thinking that there's one diagnosis. Whereas you as a parent might say, "No, I'm not, that doesn't fit in the box," right? This child isn't fitting the box. They didn't read the book. They're not fitting the idea. And so then there's a disconnect there. Best way to work through that is for you to advocate for your child, share information about your symptoms, share information about what you're seeing. Family history is always great because that can sometimes change your trajectory for things. What's going with other siblings or other kids that they're exposed to? That might change things as well. Last but not least, even if there is a little bit of a disconnect, grace is one of those things I like to see on both the part of the clinician as well as the patient, or the patient's family. You may not know what the other person knows or have seen what the other person sees, but be willing to consider that, hey, even though I think this may be the diagnosis, let's go with the clinician's thought, at least initially. But please feel free to come back and advocate for your child in a day or a couple days or a week or whenever, because if you don't agree with the diagnosis, that's a big deal because diagnosis informs treatment. Say it with me again. Diagnosis informs treatment. If you have a misdiagnosis, that means you might be given the inappropriate treatment. If it's a bacterial infection, but the parent's like, no, I want a vaccine, or I want a flu shot, that's a no, no, no. Why? Because that flu virus, that flu vaccine, or that flu shot treatment, right? Like a Tamiflu, is going to do nothing for that bacterial infection, right? You're going to need antibiotics, right? Now, antiviral, antibiotic for the bacteria, BB, right? If it's a bacterial infection, you're going to need antibiotics. So that diagnosis is important. And I really want to make sure that we're getting on the same page, because sometimes there is a reality that there is a little bit of a disconnect. Now, I'm going to give you a fourth option. Hopefully, you can stay within the three, especially if we're talking about your pediatrician, a healthcare entity where it's kind of a closed system, and you kind of only have a few people that you can see, and you want to maintain good collaborative communication. But if something happens where it's like, again, one of those non-negotiables, the provider is just not listening to you, the provider is or the patient's not listening to you and is just not willing to heed any kind of medical advice. You say left, and every time you say left, they're going right. That's where you might, as a patient, have to get a second opinion. Doesn't mean you end care with that provider, but you may need to end care with them to seek care from someone else who knows just as much or more about your family dynamics, and you feel more comfortable with them. From the provider standpoint, you already know it's a little bit more difficult if the patient's not listening. They're not. You have to show a paper trail that the patient, you don't want to be with that provider. You just don't go back. Provider, you don't have that luxury. Once a patient provider relationship's already been established, you don't have the luxury of just saying, well, I don't want to see that patient anymore because they don't listen to me, and they're wasting their time and mine, because I could be seeing another patient that wants to listen to what I have to say, right? From a provider standpoint, you have to show a paper trail of non-compliance, or non-collaborative, right? You don't want to use a compliance term. That's fine. That's great. They're not your child. You don't want to practice authoritarian medicine. Totally get it. But if they're not willing to be in a collaborative relationship, then you need to show, and usually it's a three-strike rule. You need to show a progressive pattern that asked them to do this, they didn't. Asked them to do this, they didn't. Asked them to do this, they didn't. At this point, the patient has showed multiple episodes or multiple instances that they're not willing to follow the treatment plan that we agreed on, do the work that they've said they're going to do. And at this time, I think it's my recommendation that they seek care elsewhere, right? And I'll continue to be their provider until they're able to seek care elsewhere. But I'm giving them referrals at this time and letting them know that they have until the next 30 days, the next 90 days to seek care with another provider. But you obviously need to show that paper trail to show that this is not patient abandonment, but this is, I'm an integrative health provider and I want to do things from an integrative health perspective. And I need release of information for the different other providers this person sees. They refuse to give me a release of information. They come in and they haven't done the work. They come in and they are dissatisfied with the care. I strongly recommend that they go see another provider at this time. And then you have that conversation with the patient. Yes, it may be difficult, but if you truly believe that another provider is going to be able to provide better care, then you provide them the referral. You definitely talk to that other provider if you can. If it's not someone that you know or you're not sure who the patient's going to see, you can basically give them a recommendation to call their insurance company to find a provider that is in their network that also practices whatever kind of medicine they feel more comfortable practicing. They don't like integrative care. They want to do a silo medicine. They don't want anybody else to know about their care. Make sure they've got, open access insurance where they never need a referral from their primary care provider, and they can go on and do what they need to do. Okay? So hopefully that's helpful for you. Again, when there's some disconnect between the reality of what the clinician is saying versus what a parent or you are thinking, and how to move forward in that vein. So with that said, I'm going to end this segment and say I hope you have a very blessed day on purpose as it relates to those things. And now, as we go into Mental Health Awareness Month, our first topic is the topic of anxiety. And I said I wasn't going to do this, but I'm going to share the information, but not share the way that I initially was going to share, which was, hey, it's my pet peeve and I don't like it when XYZ, but I'm not going to share it as that. I'm going to hold to my word. What I am going to say is, if you are experiencing anxiety in your body, that edgy feeling, discomfort, feeling like something bad is going to happen, waiting for the other shoe to drop in the pit of your stomach, you're feeling jittery, maybe headaches, irritability, discomfort. Guess what? Those can all be symptoms of an anxiety disorder. Okay. But I encourage you as a patient, and I encourage you if you're watching this and you're a provider, please do your homework. Okay. Particularly on the provider side. Please don't just diagnose a person with anxiety disorder. Don't just walk in the room and say you have an anxiety disorder and that's it. That should always be followed up with, there are many different types of anxiety. These are the different types. And I want to make sure that we're seeing which version you have, right? There are many different types of deficiency or being immunocompromised or having an immune disorder. Let's see which one this might be. Okay. Is this generalized anxiety disorder where you're anxious about a little bit of everything? You worry about a little bit of everything. You have a variety of worries. You worry all day and it's hard to control those worries. Or is this anxiety that only shows up randomly out of the blue, maybe once a day, maybe once a week, maybe once a month, but you've truncated what you do because you have a significant fear that it's going to happen again? Usually with the panic disorder, people limit their activities because they're afraid, if I do X again, it's going to happen again. So panic disorder, there's panic disorder with and without agoraphobia, but agoraphobia is what we used to think of with panic disorder. Agoraphobia, agora means marketplace. So in Greek, so it was the phobia, the fear of the marketplace. A person was afraid that they would be in a crowded area, they would panic, and they could not escape before either they passed out or had some other kind of negative body consequence, or they embarrassed themselves, right? They got very panicky and then embarrassed themselves. So that is usually what panic disorder has. It's either panic disorder with or without agoraphobia, meaning I can or cannot go out and about to the store, to the marketplace. I'm confined to the home, or I can maneuver and go out in other places, right? That's panic disorder. Panic disorder has very specific symptoms, but the most common one I hear people saying is, I feel like I'm going to die. I feel like I'm going to have a heart attack. I feel like something is very wrong with my body, and then it'll go away, right? And usually for panic disorder, we do want people to see their primary care doctor and or a cardiologist first to just kind of rule out any cardiac issues, because there are a lot of cardiac symptoms that happen along with panic disorder. Could this be obsessive compulsive disorder, which we look at it as an impulse control disorder more so now, but it originally was under anxiety, and I still look at it that way because usually there's a fear of something, right? Obsessive compulsive disorder, is there a fear of germs? And I'm fearful that I'm going to get germs. And so I have to wash my hands. I have to do these rituals, these compulsion, the obsession part is the fear of the germs. The compulsive part is I'm going to need to do these washing hands, taking shower routine so that it's not as bad, right? So that's something connected to OCD. There's also adjustment disorder with anxiety or features of anxiety. So usually there's an incident that happens and you are adjusting to that incident where if you took it away, you wouldn't be anxious. So you're anxious because you learned that your husband was cheating on you. And now every time anything happens, you're anxious because it could mean that there's a cheating episode. If you took away the cheating situation, would you be anxious anymore? No, that's true adjustment disorder. Okay. If you're anxious that you're going to only about taking exams, and if I took exams away and you never had to do an exam again, would that make things better? Then that's an adjustment disorder. It's a stressor that if you take it away and you remove it, the symptoms go away. That's another type of anxiety disorder. So when we think about anxiety, I love scripture, and the scripture that I want to leave you with as it relates to anxiety is from Philippians 4, 6 and 7, and 8 as well. So we have these bottles, prescriptives, right? So this is an actual bottle of medicine, but we take bottles that are yay high. And what I'll do is we'll remove the label, or I'll order bottles yay high. And I have prescriptives that we make, and I'll say, 1, 2, 3, 4, 5, 6, 7, or seventh highway, you know, holy road, heaven, whatever, 1, 2, 3, 4, 5, whatever. But then the prescription is 1, 2, 3. Number 1 is verse 6. Don't be anxious for anything. Then number 4 is, but by prayer and supplication, make your request known to God. And then number 8, and think about these things, whatever is lovely, virtuous, of a good report, anything that's praiseworthy. These are the things that you focus on. Okay. That is, I'm sorry, I misquoted verse 7. And verse 7 says, and the peace of God, which surpasses understanding, will guard your heart and minds. And then verse 8 tells you what to focus on. Okay. Tells you what to focus on. And so when I'm working with the patient, I'm usually telling them to focus on the things from verse 8. But remember that the first part of verse 6 says, be anxious for nothing. Okay. Now, the Bible doesn't always tell you how to do things. I believe that part of the how is because we're in community, and your support people in community is the how. The Bible is very good about telling you what to do and what not to do. So here it says, don't be anxious, right? Or don't be afraid. In this case, it's specifically talking about anxiousness as in anxiety, right? Not like, oh, my seatbelt came off in the middle of driving. I'm a little bit concerned about that. I'm going to put my seatbelt back on. 1, it's a law, but 2, just as important, if we were in an accident, I would want to make sure that my seatbelt's on. It's not saying don't be concerned, don't be mindful of things that are worthy of concern. It's literally meaning don't get stuck in a cycle of anxiety. Don't let your mind get stuck in a cycle of anxiety to the point where you're developing a disorder, really. But by prayer and supplication with thanksgiving, let your request be made known to God. All right. So now it's telling you what to do. Turn that worry or that anxiety into a prayer or a request of God. Then that one that I skipped, and the peace of God, which surpasses all understanding, will guard your heart and mind. Once you do your part, God will do his. Sometimes he does his part first. Hint, hint, died on a cross long before you were born, right? To purchase your salvation. You didn't have to do anything at this point except accept him and live for him. But in this case, it's saying, no, you got to do this first. Focus not on the thing that you're anxious about, but submit it to prayer. Submit it with thanksgiving. Make your request known to me. Then God's peace will guard your hearts and your mind. Now, what things can you focus on instead of what you're anxious about? Well, focus on things that are true and lovely and noble and excellent and praiseworthy. Whatever is good and virtuous, think on these things. That's what you should be thinking about. And if you don't know things to think about, literally, it's a Google search away. I can certainly tell you some things, but it's a Google search away. But what we do is we'll put in these little bottles. Usually they have 30 strips of paper. And on each of those, I've listed verses about anxiety and depression. And I've given those out. So when we have community events, that's usually what I'm giving out for the community events. And usually it's a pretty fun time. Okay. Usually a very, very fun time. So my hope is that that's been helpful for you. Again, if you're dealing with anxiety or struggling with anxiety, please start with Philippians 4, 6, 7, and 8. Be anxious for nothing and start there. Not saying not to see a mental health provider, right? Absolutely. But that should be a basis and foundation because even if you're doing therapy with one of our providers, they likely are going to tell you some things listed from this, whether you're Christian or not, whether they're Christian or not. Why? Because this actually is a basis for CBT as well, where we will have you think about one thing or tell us what your initial thought is, but then we'll have you shift to an alternative thought. Well, instead of that anxiety thought, what could you think about that's going to calm you? Okay, how about something pure and lovely and true and beautiful? How about something that you can meditate on? That's pure, lovely, and true and beautiful, right? Um, so you found it first in the Bible. So that's cool. Even if you are needing a treatment, which we do have treatments for anxiety, specifically for OCD, and we'll talk more about that later, but TMS is a great option for OCD, and we'll go through more details related to that when we talk about OCD. But for generalized anxiety, one of the first things that I will give a person is an antidepressant because anxiety and depression can be a spectrum in terms of how they present, and it can be a spectrum in terms of the medications that we use. We use the same medicine for depression that we use for anxiety and vice versa. Antidepressants. There's some esoteric ones for anxiety alone, like the benzodiazepines that some people really like using, or a few other things, like boost bars of medicine that can be very good for anxiety. But regardless, even if you're using the medicine, I'm still going to go back to the scripture and remind you to do these kinds of things. When the anxious thought comes up, what's a mantra, which is a focused thought that you can focus on? I'm going to focus on things that are noble and praiseworthy, things that are true and lovely, things that are excellent and full of virtue and of good report. That's what I'm going to think about. All right. And people love thinking about these things: puppies, newborn babies, beautiful skies, mountains, lakes, valleys, ocean, sea life. They fit the bill for verse 8. So my prayer is that you will go there and you'll focus on some of those things as well. All right. I'm Dr. Virginia, and you guys have a very blessed day on purpose. Hey, everybody, it's Dr. Regina, and I wanted to give an update for you as it relates to anxiety. So here goes. Be anxious for nothing, but by prayer and supplication, make all requests made to God. Then the peace that surpasseth all understanding will guard your heart and your minds. What would you think that you should work on or focus on? Well, you focus on things that are lovely, of good report, of virtue, anything that's praiseworthy, anything that's lovely, anything of virtue. These are the things that you would focus on. Okay, so I'm going to share that again. Be anxious for nothing, but in everything by prayer and supplication with thanksgiving, let your requests be made known to God. And the peace of God, which surpasses all understanding, will guard your hearts and your minds through Christ Jesus. Finally, brethren, whatever things are true, whatever things are noble, whatever things are just, whatever things are pure, whatever things are lovely, whatever things are of good report, if there's any virtue, and if there's anything praiseworthy, meditate on these things. Hi, I'm Dr. Regina with Lead Life Psychiatry. I'm a board certified psychiatrist as well as a lifestyle medicine physician. And I will tell you, being raised in the church, if we talked about meditating, that was one of those taboo things. It was, well, why are you wanting to mix the worlds with things of God? Like, I don't want to do meditation and yoga and get into chakras and stones and crystals and all of these things. The problem is two things. One, we have equated some things that are of the world that are not the most holy, right? Those are things that are called divination. And then we've just thrown in things that we didn't understand and called it not so healthy. But the Bible uses the term meditate multiple times throughout the Old and the New Testament. And here we see it yet again in Philippians 4, 6, 7, and notably verse 8. It specifically tells us, Paul specifically tells us, that there are things that we should be mindful of and we should focus on. We should meditate on these things. Now, what does it mean to meditate, right? It means to basically have a fixed thought on these things. Why is he talking about this? It's in the context of anxiety. So, yes, we've talked about anxiety disorders before, but in this specific context, what it's talking about is the fact that if you are so anxious, so worried, so overly concerned that you're getting consumed by these anxious thoughts, and it is either becoming a disorder or it has become a disorder for whatever reason, there are things that you can do. Yes, medications might be in the mix. Yes, therapy might be in the mix. But this is kind of the thing that you do in between. You take a medicine one at the beginning of the day and you still get to live with you and throughout all the rest of the day, people in community and society and work. You go to therapy once, maybe twice a week. But outside of those 2 hours, you've still got a good 142 hours for the rest of the week, again, to be with you and to be with whoever else is in your space. So during those times, what should you do? The Bible is very explicit about this. Instead of worrying about your concerns, instead of worrying about the things that make you anxious, meditate on things that are pure and lovely, of good report, things that are virtuous, that are praiseworthy. These are the things that you should be doing, right? And it tells us if you do your part, God will do his part. Usually, God has done all the work. The fullness of the major works from a spiritual standpoint, he's already done. Died on the cross, was raised. You believe in him, you're raised, resurrected with him through baptism. You're good. But what do you do in the meantime? The Bible says work out your own salvation. This is a part of that. What do you do on the day to day to day? Bathe everything in prayer, lift everything up as a supplication, as a prayer request to God with thanksgiving, as if you've already received it. Let him know about it, like because he's a good, good father. And then his peace, you did your part, now he does his part. His peace that surpasses all understanding will guard your hearts and it will guard your minds. It'll guard your hearts so there's not this fear and anxiety sitting here, and it'll guard your mind. So there's not fear and anxiety resting here and ruling here. Okay. So again, Philippians 4, 6, 7, and 8. And we do have these in our little bottles that we give our patients. And if you want one, just send us a message, send us a DM, or send us a message as a comment, and we'll see what we can do about making sure that we can get you a downloaded version of this. Okay. All right. You guys have a very blessed day on purpose. Take care.